talking a little bit about our health. We talked about tonight, we're going to be talking about healthy, wealthy, and wise. So your health is everything, right?
Absolutely. It sure is.
So,
and, you know, we appreciate Mary Bird Perkins, Our Lady of the Lake Cancer Center, sponsoring our medical segment each week. But tonight, you got me.
That's right. So
I'm here every week. So,
that's right. Dr. K. Solar is just a smarty pants girl.
Oh, that's right. My pants are very smart right now.
She does. And so we really do enjoy all the health information that Dr. K shares with us. And it's on a variety of topics. But today, I think her topic is especially sweet.
Oh, I don't
like
know
us.
if
it's especially sweet like us. Like, don't give us any sugar.
I put my glasses on so I would be all like, you know,
sweet
showing you my smarts bets. So, and you know, I know a lot of people don't think about this as much, but how important sleep is as far as your overall health and impacting it. And in fact, almost 20% of Americans do not get enough sleep.
It's more than that.
I think it's probably more than that.
There's no way.
I think it's probably more than that, too.
It's more than that.
Because, you know, when they say that you're sleep deprived, that means that you're getting less than 7 hours on a regular basis. I feel like I got that the whole first half of my life.
Yes.
I mean, don't you?
I look back and I don't know how I slept so little in college. I think it was the number of jobs I was working. But I do think as we get older, we have more and more on our mind and we're doing more, and it's hard to wind down, or at least for me it is.
I think what I used to always say is like, man, I just don't have time for sleep. If I really did not have to sleep at all, because I wouldn't want to miss something. I'm missing something if I'm sleeping.
Yeah.
But you're going to miss a whole lot in the latter part of your life if you don't sleep, because that is when your body rejuvenates itself. That's when it repairs itself. And if you're not getting adequate sleep and the right type of sleep, then you're not getting those reparative changes. And there was a study that came out in 2010 that said if you sleep too little at night, it's associated with early death. Now, I don't know about you, but most of us would like to live a little while, especially when we're talking about retirement. So, you know, and I think a lot of times we don't think about all the aspects that sleep deprivation affects us physically. And a lot of it is if you're overweight or you're trying to lose weight, if you're not sleeping enough, it's going to make it very difficult. And there's some reasons why. There's these hormones that like change during the night that cause you to either feel like you're full or hungry. So if you don't sleep well, you know, if you stayed up half the night, why do you feel like, oh my gosh, I'm so hungry, I really need to go eat a greasy burger the next day? That is part of what's going on with those hormones in your head. They make you feel hungry. They also make you crave carbs and not the best of things.
Right.
And also you have increased cortisol levels, which makes you store fat.
Yes.
And you burn your energy from muscle. So it does a lot of things that makes it difficult for you to lose weight and makes you gain weight, actually, if you're sleep deprived. The other thing, you know, we look at heart disease. If you're not getting enough sleep, your blood pressure normally your blood pressure will lower during the night. So if you're not getting adequate sleep, your blood pressure, your mean blood pressure is actually higher. And that, of course, increases your risk of heart disease. And also, all these little chemicals that go on to help improve your immune system and reduce inflammation, they cause inflammation to be chronically elevated. So if you're chronically lacking sleep, you're having a chronic level of inflammation going on, which also increases heart disease.
You know, you think about you and your husband were both in medical school. You don't sleep in medical school. They don't let you sleep. They make you work. Right. And then, like, think about guys in the military or women in the military, anybody in the military, anybody that's a first responder, law enforcement. They don't get regular sleep. Plant workers, refinery workers. So it seems like maybe the shifts could change or something could change to at least give people a time to kind of catch up.
I think part of it is that, you know, we don't really realize the impact of that on our health.
Right.
You know,
until later.
Yeah. And that's why I'm thinking about it now, because it's later. But, you know, also you don't manage insulin as well. So you have a tendency to have elevated glucose. We mentioned the immune system. Your cognitive performance isn't as good, you know, because if you are lacking REM sleep, and REM sleep is what happens in the early morning hours. That's the dream
That's when
state.
I get my best sleep.
But well, good, Betsy, because that means that you're consolidating those memories, and you're going to have better memory and better creativity.
Yeah.
So, but also if you're lacking deep sleep, especially for teens, then
teens need it in a different way.
everybody
Explain
needs
that.
deep sleep, but the deep sleep is that early part of the night. That's where actually you're repairing, you're restoring your body. But for children and teens, that's also when a lot of those hormones that's causing them to grow properly, to go through those pubertal changes, to increase their muscle mass, all those kind of things. So that's important. And of course, your mood. We don't think about that, but people who are having trouble with depression and anxiety, the first thing they need to do is make sure that they're getting adequate sleep, because that definitely can be something that's affecting
But when
their
people
mood
have
and their
depression or anxiety, they also could be sleeping too much.
Well, you can do that as well.
You've got to really monitor yourself.
You've got to make sure, what is normal sleep? It would be anywhere from 7 to 9 hours for adults. Anything less than 7, and especially if it's 5 or less, can cause significant health issues. But, you look, well, what can I do to improve my sleep? And I've heard people say, oh, if I have a glass of red wine before I go to bed. That is truly probably not the best thing for you to do, because if you use any device where you're monitoring what your sleep quality is, you will see that causes your heart rate to be elevated. That may cause your body temp to be elevated.
Or an Apple Watch, would that be affected by one glass of red wine or alcohol?
Everybody's different on what their tolerance is, but I can tell you, I wear this Oura Ring, okay, and it's very good as far as looking at. It monitors your heart rate, your respiratory rate, looks at your temperature, and all those things can be affected. If you eat a meal really late at night, if you have that late night pizza party, you can tell. And you can tell on the quality of your sleep. You may not have got good deep or REM sleep. And you will see that your heart rate was elevated and your body temp was elevated, because your body is working to digest that and do all that stuff. It's not spending its time restoring the things that it needs to for you. The same thing as if you have alcohol at night or if you have caffeine late in the evening. Those things can affect that. And so a lot of these health devices, it helps us see what's actually going on in our sleep, that we might be thinking that we're sleeping okay. And when you look at it, maybe you're sleeping 8 hours, but you're not getting enough REM, or you're not getting enough deep, or and if we try to go to bed around the same time, get up the same time, and then when we get on a schedule, we kind of cut those things out late at night. And if you're monitoring, you can really see what is affecting your quality of sleep.
So is it healthier, would you say? So I have a close friend who goes to sleep about 8:30, 9 o'clock, is very exhausted if they don't, but automatically wakes up 4:30, 5:30 or so. Is that better? Or is it someone like me who I'm a little bit more of a night owl, 10:30, 11 o'clock, maybe a little later, and then I'm up at between 6 and 6:30?
Well, I think,
what's better for you? Is there a better?
I think it is consistency.
Because I think I'm missing something if I go to bed at 8:30 most nights.
Well,
I don't know what.
You think you're missing out.
I think I'm missing out.
You think you're missing out. But, some people, they have a very productive day if they get up early. And I have read some studies that said if you can get up early, like 5:30, 6 o'clock in the morning, but you're not going to have good sleep if you're that person who goes to bed at 11.
Right.
And you get up that early. That's not going to do it. So it's consistency. It's not being so exhausted that you fall asleep in, less than 5 seconds. You should wind down before you go to bed. And I don't mean wind down, because as we said, that's not good.
Look, don't pick up your cell phone or look at a screen, okay?
Because get rid of
that's
the blue
hard thing, because
light.
if you're bored and you're trying to go to sleep, you might want to check social media.
You want it to be quiet. What you need to do is take that warm bath. Maybe have you a nice warm tea if you feel like you need something, because a lot of the herbal extracts that they have in the chamomile, the lavender, this tea I've got up here is bedtime tea, because it has a mixture of several of those, can kind of help you relax if you're somebody who feels like, I just got to have something something, at night. But all of those things, making sure it's a relaxing environment. They say, keeping your temp 60 to 67 degrees for when you sleep. So
60 to 67.
That's what they say is the optimal.
That's a little chilly.
Sure. I'm saying that my house is probably like that. It's not 72 like it is during the day.
Yeah.
It gets
it depends on if you have pets that are sleeping with you, if there's somebody else sleeping with you who has a higher body temperature.
I can tell you, if my dog walks all over me during the night, I've got multiple little things where I was awake, and that's a restlessness thing because I woke up a whole lot, and then my sleep score is going to be terrible, and I can tell.
We need to know more about this Aura ring that she's flashing around, so we need to do a medical segment on monitoring your health. But I'm so glad you brought this good sleep stuff. I think I'll go to bed early tonight and see if I can't feel better tomorrow. Not that I feel bad, but
you're just going to want to make sure you get the right amount of hours of sleep and do the right things so that it's good quality sleep.
Yeah, I need to work on that.
Oh, and up next we got music that's going to, probably make us want to jump up in our chairs with Taylor Nodda. So y'all stay put.